Hi, we're here at Back in Shape. There's Karen Paget and her fantastic Pilates studio. Karen, you get a lot of people at Back in Shape with back pain.
That's right.
And you have a lot of Pilates equipment. What sort of people are coming in, and why do they come in to see you for Pilates in particular?
Well, it's a lot of back pain. If you talk to the sort of Joe public about what Pilates is, almost without exception, people will comment on Pilates as being the thing you do if you have a bad back.
Mm-hmm.
That rather understates what Pilates is all about. It's about training somebody's body to be functional for their everyday life. So that could mean it could be specifically targeted to a sports person for their sport. It could be targeted to an older person to encourage strong balance and good posture.
Mm-hmm.
Everyday individuals stuck at a desk all day to undo some of the damage to a body caused by just physically being stuck at a desk.
Right.
Based in the physiotherapy clinic as we are here, a lot of the inquiries and a lot of the patients come in with various issues to address, hence they're here for clinical help.
Yeah.
And the equipment allows us to be very, very specific to that individual's needs in helping to recuperate from and rehabilitate from injuries and what have you.
So do you do one-on-ones or do you do classes, or how do you typically help people?
We do both. We have Pilates instruction in groups.
Mm-hmm.
Because I have 5 specific machines, our groups are tiny. They're a maximum of 5 people, which also means that despite it being a group, it can be very prescriptive to the individual.
So do you kind of work with each person on their station?
Within the classes.
Right.
We also teach on a 1-to-1, sometimes a 2-to-1 basis.
Mm-hmm.
We will also send people home with a little bit of homework, but in anticipation that very few people have a machine at home, there'll be a bit of mat instruction as well involved in what we do.
And so how often would people typically come for Pilates?
Typically
what do you
once a week.
Okay.
And for a lot of people, we have had clients and patients that start training because they're rehabbing and eventually give up gym membership because they get a much better result from coming in for their 1 or 2 classes a week over and above the kind of improvements and strength gains and mobility gains that they've been seeing with their gym membership. So yes, there is a cost issue, but you kind of balance it out with what you're looking for.
Okay, so if somebody wants to come, are they better off coming as a one-on-one, or can they start in a group, or what should they do?
Certainly better for one-on-one to start with, simply because again we can be very prescriptive to you as an individual.
And is that to sort of show them how to use the kit, or?
Yes and no. The kit, in terms of how you use it, is really
quite
basic.
Yeah.
But setting up individual exercises for the individual again requires a certain amount of prescription for that individual.
Okay.
So I could, for example, show you an exercise that won't look very special but can be really challenging for the individual performing it.
Okay. So they just phone the clinic and book in to see one of the Pilates teachers for a one-on-one. Okay. Fantastic. Well, you've got a great setup. I know the outcomes because I've talked to a lot of your patients. So thank you for that.
Thank you very much.
People can find out. What's the website?
www.backinshape.co.uk.
The obligatory quota. Okay. Thanks, Karen.
Thank you.